show. For example, we have skeletal muscles, we have a heart and also brain. For example, MB is most frequently in a heart muscle. What about MM? As you can see here, MM can actually find in, for example, muscles of the leg or muscles of the hand. And about BB is specific to the brain, but it can found in some gastrointestinal tract and also bladder, but in a very low concentration. Okay, in a very, very low concentration we have in the gastrointestinal tract and also in the bladder. But most of them are related. For example, if you have a brain stroke, which type of creatine kinase increase? BB. Okay, because it's most frequently inside the brain. And about MI, it is very important to MB. Okay, because in a heart muscle we have it MB and a little amount of MM. But MB, for example, for heart is very important. So, any problem regarding to the muscles, I didn't want to bother you to remembering this disorder, okay? Because maybe we have to memorize several names, but I want to help you. As you can see here, any injury, any inflammation or crash to the skeletal or heart muscle, it can increase to the creatine kinase. Like, for example, viral myositis. It means that we have some viral infection of the muscle. Or if we have a polymyositis, it means that we have more than one type of muscle are infected. It means that polymyositis. As you can see here, all of them are related to the muscles. So if you actually have some question and I ask you which of the following is related to the increased amount of creatine kinase, and I give you liver hepatocyte damage, I don't know. Maybe I ask you a spleen disorder and pancreas disorder and, for example, viral myositis. Because you can find the word of myocyte and muscles and you can choose the correct answer. And, for interpretation of the result, these points is very important. Because for many enzymes, some drugs can affect the activity of that enzyme. For example, if your patient have a high cholesterol and he or she takes some statins, okay, this drug can affect the normal range of creatine kinase. So, what I mean, and for example, fibrates, antiretroviral, and other drugs can affect and can increase the activity. So, what is the important point? Again, I repeat this point. You, as a physician, you should ask all of the actual information about your patient. How old are you? Are you married? Are you pregnant? Do you take any specific drug? Okay. What is the name of drug? This is the anti-hypertension drug. This is the anti-hyperlipidemic drug. Okay. So because some drugs can affect, and as a physician, you know that. For example, okay, my patient has a high cholesterol, and she told me she take a statin. Okay, and I want to repeat. I want to actually evaluate some problem regarding to the, for example, brain or to the muscles. And the normal range of creatine kinase is a little higher than normal. Can be suspected, for example, to the MI? No, because she takes a statin. Okay, so we should consider all these points for the better interpretation the result. And what is the most important application of this enzyme for the MI or acute myocardial infarction? What is the main important type? Creatine kinase MB or type 2 is important for the heart attack. And for diagnostic is very important. What is the pattern? It raises in a concentration during the heart attack and we have a specific index that's related to the function of the heart and known as the cardiac index. It is the ratio of the creatine kinase MB to the total creatine kinase. That has actually a specific normal range, and each laboratory, according to the procedure, have a specific normal range. So you don't suppose to memorize, and it is not logical to memorize what is the normal range. So all the time you will have a result, and in front of the result you have a normal range. So according to the normal range, you can interpret it is higher or lower than normal. So you should, I just want to mention this ratio also is important to the evaluation of the MI. It's generally raised 2 and 4 hours after the whenever you feel the pain in the chest. Okay? After 4 to 6 hours, it starts to increase, okay, and reach to the peak, and sometimes only 2 hours actually it starts and reach to the peak, as you can see here, this one, okay, and after 2 days it reached to the normal, okay. Please consider these patterns. This is the alteration patterns about the days of the onset of the infarction. It starts 4 and even 2 hours after start the MI and reach to the peak near 24 hours, okay, or less than 24 hours, and reach to the normal range. After actually reach to the normal range after 2 days after onset of the chest pain, okay. What is important this pattern and what I want to show? At first, I want to show for the MI not only creatine kinase is important, but if you have a correct interpretation, you should consider many factors. Okay? Creatine kinase, AST, lactate dehydrogenase, and also some non-enzymatic biomarkers like cardiac troponin. And troponin I and troponin T is important. What does it mean? It means that, for example, about the cardiac troponin, I want to show that sometimes you have a patient and she complained about the chest pain 3 days ago. 3 days ago. And as a physician, you suspected to the occurrence of MI. Is it correct to order, so you should order some actually laboratory finding, okay? You should ask from the patient to measure the activity of some biomarkers, like for example, enzyme and other biomarkers. Is it correct after 3 days, okay? Is it correct to order the measurement activity of the creatine kinase MB? No. Why?
Because it ends at the second day.
After 2 days, it reached to the normal. And you miss the information. So, if, for example, the patient immediately after 2 hours of the feel of the pain inside the chain refer to, it's correct, okay? But because it reached to the normal range, so this marker is not suitable. So you should choose another markers, and especially lactate dehydrogenase. In the next slide, I will introduce this marker, but lactate dehydrogenase, because it's stay for a long time, can be considered as the best actually choice whenever your patient actually feel, for example, maybe a week, actually maybe many days ago, feel some pain in the inside the chest, okay? And you should consider this point. Besides the enzyme biomarkers like creatine kinase, lactate dehydrogenase, non-enzymatic biomarkers is important. So you should be familiar with these markers. And as a physician, if you want, for example, if you have only one choice to evaluation the acute myocardial infarction, I think troponin is very important. Why? Because as you, about the previous slide, I showed that the distribution of the creatine kinase, and we have a brain creatine kinase, we have, for example, muscle, and also in a small amount in the bladder. In the gastrointestinal, we have this enzyme. But you can take enough troponin, only 100% of this molecule found inside the heart. Okay? But creatine kinase MB is specific. But MB, for example, like this, is specific for heart. But a little amount can find in other site of the body. What about this biomarker? Marker means that a molecule that is related to the specific organ. But because you can take enough, and 100% of this molecule is frequent, as actually found in the heart, so this is the best choice for evaluation of the MI. About the disorder, we have some Duchenne dystrophy and rhabdomyolysis. Duchenne is a syndrome that's related to some problem regarding to the protein known as a dystrophy, and it can help to the muscles to move. And enzyme activity in the serum is very high, especially this disorder found in infancy and childhood. And also rhabdomyolysis, for example, after the car accident, any injury, any trauma can affect the muscles known as a rhabdomyolysis. So in both of this situation, the creatine kinase is high. What is the question, for example, here? Maybe I ask you, in a rhabdomyolysis or Duchenne syndrome, which enzyme is a specific choice to evaluation this disorder? Creatine kinase is best, okay? Not, for example, other enzyme. You should just know the name of the enzyme, the name of the disorder.
What about dystrophin?
Dystrophin actually is a specific protein that participates in a contraction of the muscles, okay? And whenever this is a genetic disorder, and these are genetically have an abnormal function of the dystrophy, okay? And it can result in a paralysis, okay? Because in this disorder, the muscles are infected and also they don't have any specific function and they lose a specific function. It can result in alteration in the creatine kinase activity. As I mentioned, any disorder, no matter, this is a crush, no matter, it is a MI, I don't know, it is a trauma or paralysis or vigorous exercise, because in all of these situations, muscles are involved, it can result in alteration of the creatine kinase activity. Another muscle-specific enzyme is aldolase, and I think you have a carbohydrate metabolism.
Yeah.
Where we can find this enzyme?
Glycolysis.
Excellent. During the glycolysis, we have this enzyme. And this enzyme, so I didn't want to focus what is the function of this enzyme. You should just know that this enzyme is present especially in a muscle. Okay? About aldolase, you should just know that this is a muscle-specific enzyme. Okay? So any disorder like dystrophy of the muscles and about some inflammation of the muscles, it can result in, for example, in a Duchenne syndrome, it results in alteration in concentration of the aldolase. Okay? So I want to continue with the liver enzyme. So aldolase and creatine kinase were muscle-specific enzymes. In the next slide, I want to introduce the liver-specific enzyme. As you know, as I mentioned, because the liver had a different role and different metabolic pathway occur inside the hepatocyte or liver cells, this organ is very important and is full of enzymes. So, as you can see here, we have some aminotransferase. Tomorrow, we actually we will focus on the role and function of this enzyme. Aminotransferase. What does it mean? Excellent. They transfer amino, okay, from one substrate to other substrate. Okay? And these enzymes are very, very important in the catabolism of the amino acids. Okay? Because if you remember, we have a specific structure for the amino acid. H group, amino group, and carboxyl group are constant. Okay? What is the variation? R. For example, sometimes it's a hydroxyl, acidic, or basic structure. So, aminotransferase like aspartate aminotransferase or alanine aminotransferase considered as the most important enzyme. So, if you have some patient who is not ill, okay, he or she wants to have a normal checkup, routine checkup, as a physician, you should order the measurements of the aspartate and alanine aminotransferase, and also known as the OT and PT enzyme. These are the normal tests and actually normally asked from the patient to evaluate the liver function. If this activity is abnormal, you should order other specific tests, okay? So these are the general liver function tests, okay? So if I ask you, which enzyme are considered as a general liver function test, aminotransferase like AST or SGOT, or in abbreviation known as the OT. Between the physician, it's very common to tell that this is an OT enzyme or this is a PT enzyme, okay? So if these enzymes are abnormal, so you should ask, for example, some sonography test, some other enzyme, maybe this is a glutamate dehydrogenase, GGT, gamma glutamate transferase, and other specific enzyme, okay? But these are not for normal routine checkup. Only aminotransferase considered as a normal checkup. Okay, I will start with the aminotransferase. They catalyze the interconversion of the amino acid. This is the aspartate and 2-oxoglutarate. 2-oxoglutarate has another name. This is the alpha-ketoglutarate. Okay? So, aspartate and alpha-ketoglutarate, following the reaction of the aminotransferase, convert oxaloacetate and glutamate. Okay? These are interconversion of the amino acid. Substrate is aspartate, product is glutamate. Okay? And alpha-ketoglutarate and oxaloacetate. And about alanine aminotransferase, convert to the pyruvate. As you can see here, what is the difference here? NH2, excellent. So, because, as I mentioned, this is aminotransferase. It means that they detach amine from amino acid to the and added to the other substrate and produce the new amino acid and the other, for example, product. This is a pyruvate for alanine. So, if I ask you, whenever I remove the amine group from alanine, what is the product? Pyruvate. So, if I remove the amine from aspartate, what will be the product? Oxaloacetate. So, another question. This is a 2-oxoglutarate or alpha-ketoglutarate. If I add an amine group to the alpha-ketoglutarate, what is the product? Glutamate. Okay? So we should consider this point because tomorrow we should actually memorize all these details because these are very, very important step of the amino acid metabolism.
So,
and what is the...
so we take the amino acid, the amide group from the amino and we give it to the alpha ketoglutarate and it makes the glutamate.
Yes. And produces glutamate.
And
this is the interconversion of the amino acid. For example, aspartate convert to the oxaloacetate and also produce glutamate.
And the other part from the amino acid is turned into
acid. This is a kind of alpha keto acid. You know, alpha ketoglutarate and oxaloacetate considered as the alpha keto acids. because they contain a keto. What is a keto? CO. CO is a keto. So all of these products, no matter this is a 2-oxaloglutarate or alpha-ketoglutarate, oxaloacetate, pyruvate, all of them considered as a keto acids. Okay? So these are the interconversion of the amino acid. What is the cofactor for this reaction? Pyridoxine phosphate. What is the vitamin that produces which vitamin? Excellent. Vitamin B6. If you remember from the vitamin session, most of the vitamin have function as a cofactor. And for example, we have a thiamine for the transketolase. We have a riboflavin, FAD and FMN for the dehydrogenase enzyme, and ADPH for the reductase enzyme, and pyridoxine phosphate, vitamin B6 for the main enzyme, and one of them is the amino transferase. So if I ask you which vitamin is important and is vital for the function of the amino transferase, pyridoxal phosphate or vitamin B6 is important. And it is a tissue distribution, and if we compare the tissue distribution according to this table, please tell me in which organ we have the highest concentration of alanine aminotransferase or ALT?
The heart.
The
heart and
liver. So, as I mentioned, these are two general liver function tests. But also, between these amino transferase, which of them is specific, more specific for liver? ALT. Why? Because it has a higher concentration in a liver. And also AST, as you can see here, has a high concentration, but which organs produce the most? Heart. So if you remember from the chart that showed some markers about the MI, one of them was AST. So because heart has a high concentration of this enzyme, this enzyme can consider as an evaluation of the function of the heart, evaluation of the occurrence of the MI. And you should know that throughout the tissue distribution, ALT is exclusively cytoplasmic. But for example, we have if you remember, we have some tissue distribution, not only tissue distribution, organelle distribution. It means that we have both mitochondrial and cytoplasmic AST. So, AST has two sites inside the cells. One of them is cytosol, another one is mitochondria. What about the ALT? Only cytosol. Okay? About the clinical significance, as I mentioned, liver disease is the most important, and as I mentioned, these are the normal routine tests for the evaluation of the liver disease. And according to the tissue distribution, because ALT has the highest concentration in the liver, most of the time ALT is higher than AST, okay? Whenever you have some liver disease. But we have some exception. This slide is very important because normally ALT in a liver disease is higher than AST. But as a physician, you should know these three exceptions. So, if your patient drink a lot of alcohol and this alcohol results in inflammation of the liver, so it is known as alcoholic hepatitis, and also in a cirrhosis and some malignancies of the liver or neoplasia. In these three situations, AST is greater. Okay? Normally ALT is greater. Okay? So if I ask you, only just these three situations, okay? What other disorder, like in the previous slides, like this disorder, it can result in an alteration of the ALT more than AST. But these three types is important.
What does cirrhosis mean?
Cirrhosis, actually, you know, we have a different type of liver damage, okay? According to the amount of the damage, we can say this is a hepatitis, cirrhosis, or for example, NAFLD. These are the different level of the tissue damage, okay? And they have a specific pattern. Cirrhosis is a specific kind of liver damage that we have a specific pattern of alteration of the some liver specific pattern, okay? And finally, it can result in a malignancy. You know, for example, at first we have a grade 1 fatty liver. When it progress, it can form a cirrhosis, okay? And after, if the damage of the liver continue, it can result in a malignancy and death of the organ of the liver. These are different level of the damage to the liver. Yes, you have a question?
Is liver neoplasia like some sort of cancer or something?
Yes, neoplasia, it means that the abnormal growth of the hepatocyte. This is not benign, okay? This is malignant growth of the liver cells.
But in the previous slide, it seemed as though AST was already greater than ALT
Yes,
levels.
most of the time.
So, does that in the slide you said though that
I
these
mean, what does it mean? It means that we have some ratio, ALT to the AST, okay? As a physician, you should know that it is considered as one of important index to evaluation of the liver disease. Most of the time, because in many liver disease, ALT is more than AST. What does it mean? It means that all the time the ratio is greater than 1. Okay? But we have 3 exceptions, and these 3 exceptions,
Alcohol.
this is less than 1. Okay?
But in the table, in the previous slide, it seemed as though always the levels of AST were higher than ALT.
This is a tissue distribution, okay? Please do not make a mistake about tissue distribution. This is not related to the disorder. This is the concentration of each enzyme in a heart, in a liver. These are not index of the disease. These are just the value of the enzyme that present, for example, in the erythrocyte, in the lung, okay? These are not related to this evaluation. Okay? Please do not confuse the result. Okay? And this slide shows the peak value of the aminotransferase regarding to the liver disease. For example, this peak value is between 7th and also 12th days after the onset of the injury. So as you can see here, the peak level, we reach to the peak level after 12 days, after, for example, in any disorder to the liver. And you should consider this point, AST and these, actually ALT activity are elevated sometimes even before clinical sign. Okay, maybe you have some sign, clinical sign, and it is very clear that there is some problem to the liver. For example, maybe the patient, the white part of the eye actually convert to the yellow color. These are some symptoms. But if you want to evaluate, it's better to order at first the aminotransferase to evaluate some disorder. Okay, another disorder regarding to the liver. This is alcoholic hepatitis, and as the name implies, what is the reason? Drinking heavily alcohol. So this is a very, very important situation, and this is a specific type of the damage to the liver can result from the, for example, drinking heavy, for example, more than 3 bottles a day, okay? Because some people are addicted to the alcohol, they drink a lot, so it can result in alcoholic hepatitis. And And this is some screening test, and this is just for more information, and you don't suppose for this. As you can see here, for example, AST-ALT, the ratio is normally lower than 1, but here it is upper than 1. And also we have in NAFLD, I want to introduce the non-alcoholic fatty liver, okay? Maybe you have heard that. A patient who have a fatty liver, most of them drink alcohol, okay? But it is not true. Why? Because we have another situation, and it is a non-alcoholic. So it means that this is not related to the drinking alcohol. What is the reason? In the next slide, I will show you. In the non-alcoholic fatty liver, we have the alteration also in AST and ALT. In this slide, you should just know that in a non-alcoholic fatty liver, we have an alteration of AST and ALT. Just you should know the name. For example, in a non-alcoholic fatty liver, what is the symptoms? They are very fat. They have a very high BMI. They have increased waist circumferences. They have elevated of TG, triglyceride. They have a high fasting insulin, okay? And also they have a low good lipoprotein, and the name is HDL, okay? So as this result, we consider as a non-alcoholic fatty liver. So whenever you as a physician, you observe it, okay, at first anthropometric, like a BMI, like a weight, okay, as a physician, okay, you are too fat. Not only you have a high BMI, also your TG is high, and also your insulin level is abnormal, so you are suspected to have a NAFLD, okay? So you should prescribe some drugs that are specific for the NAFLD. And these patients are very, very susceptible to take a diabetes during the next years, okay? NAFLD is very related to the diabetes, okay?
Khanum, what does fasting insulin mean?
Fasting means whenever, for example, you are fast and refer to the laboratory, and some experts take a blood, they measure a different criteria, like fasting blood sugar, FBS, TG, cholesterol, liver enzyme, AST, ALT, I don't know, some hormones, and also insulin. In some situation, you should know that what is the concentration of the insulin in a fast situation. So because it's actually has an important value, especially for diabetes, for the metabolic syndrome, and also for NAFLD. So you should measure in a fasting situation, okay? Because if you eat a meal, we have increased amount of insulin, so it is not valuable. So you should measure the concentration of insulin in a fast situation. And also we have a slight and moderate increase of the aminotransferase in taking some drugs like statin, like antibiotics, and some anti-inflammatory drugs. So you should consider this one. Another enzyme that is specific to the liver is alkaline phosphatase. Alkaline phosphatase have a wide distribution, may be considered as a bone specific, may be considered as a placental specific, and also liver specific. So in this slide, I'm talking about the liver specific alkaline phosphatase. As the name implies, they are active at an alkaline environment or high pH, like a 9, like a 10, okay? And the exact metabolic function of this enzyme is not understood yet, and sometimes some scientists believe that they are participating in a lipid transport, and calcification process in the bone is actually, I think, is more important than the first role. We have a little amount of this enzyme from the intestine, and it can maybe present in the individual of the blood type who have a blood type B and O, okay? group B and O normally have a little higher amount of this enzyme, okay? So again, another question you should ask from your patient, it's a blood type. And it is only for this enzyme because a patient who have a blood type B or O has actually normally upper than normal range a little, okay, from this enzyme. And also you should know that zinc is very important metal ion and it is constituent metal ion for this enzyme. About the tissue distribution, we can find in a liver, in an osteoblast, in a placenta. What does it mean in a placenta, for example? You don't have any information about your patient and you don't know your patient is a female or male. And you have a higher alkaline phosphatase activity in the serum of your patient. Maybe your patient is pregnant, okay? Why in a pregnant people we have a higher normal range for this enzyme? Because of
the fetus. It
Nutrition.
has its own needs, so we need to make more of everything for the fetus.
no. What is the reason they have a placenta? Especially regarding to the third trimester, okay? Especially in the third trimester, because the actually size of placenta increase. So normally in a pregnant woman we have a higher than normal. So it is not related to the bone disease, I don't know, to the liver disease, okay? And also we have some small intestine and some proximal tubules in the kidney. But these are very less concentration. So you should consider this point. These are vary between the age and the gender. And the next session I will describe. We have a different normal range for the male and female. And also we have a normal range, for example, up to 55 years old, we have a normal range, and older than, for example, 50, we have another normal range. Why? Because age can affect the enzyme, gender can affect the activity of enzyme, and also infants and peripubertal, whenever P and R is close together, it's difficult to pronounce. They have a normally higher than a normal range. What is our normal? About the clinical significance, alkaline phosphatase actually considered as a hepatobiliary disease and also bone disease. They increase in a patient who have some malignancies or metastases. And also, as I mentioned, during the third trimester, they have a higher than normal. And what is the origin? Placenta. And also, this is a bone-specific enzyme, okay? Because not only it's found in the liver, but also it can be found in a bone. So osteoporosis in a normally growing children, because they have a high activity of the osteoblast, and also in a bone fracture, we have a high concentration of the alkaline phosphatase. And also in a Paget disease, we have a high concentration of this enzyme. What happened in a Paget disease? In a Paget disease, we have uncontrolled activity of osteoclasts, okay? They resorb the bone, okay? For controlling, so we have the bone destruction. So for compensation of this destruction, our body increase the activity of osteoblast. So as I mentioned, inside the osteoblast, which enzyme is present? Alkaline phosphatase. For in Paget disease, because our body wants to compensate the destruction of the bone, increase the activity of the osteoblast. So we have a high concentration of alkaline phosphatase. And also in a vitamin D deficiency, any situation that can affect the bone. In a vitamin D deficiency, our bone is affected. And also in a hyperparathyroidism, the high activity of parathyroid hormone because we have a bone involvement, okay? Because parathyroid hormone can affect the metabolism of the bone. In this situation, we have a high concentration. And some cancers and some metastases can result in an alteration in the alkaline phosphatase. And now the pancreatic enzyme, as I mentioned, these are important, especially for the digestion of the food. Okay? When you start, are you okay? Yes. Okay. For example, when you digest the rice or bread, okay, the indigestion of the starch start inside the mouth. Okay? Why? Because we have a salivary gland. The salivary gland produces amylase. This is the first enzyme that starts digestion of the starch. So, the digestion of the carbohydrate start inside the mouth as a result of the amylase. So this enzyme considered as a metalloenzyme. What does it mean, metalloenzyme? For example, alkaline phosphatase also is a metalloenzyme.
It binds to the metals.
Does it have a metal ion?
Excellent. It's very simple.
Simple metals with ions.
When the enzyme requires a metal ion for the function, it's known as a metalloenzyme. For example, for alkaline phosphatase, zinc is a
and
metal.
magnesium.
And for amylase, calcium is important. So, as I mentioned, they catalyze the glycosidic linkage of the polysaccharide. Maybe this is a linear, like amylase, and like branch, like amylopectin and glycogen. So, all of them can actually hydrolyze by this enzyme. This enzyme is small enough to pass through the glomerular of the kidney. So this is very, very important. Normally, we cannot find any enzyme in the urine because we have some barrier in the glomeruli of the kidney. They inhibit from the entrance of the enzyme to the urine, okay? But because amylase is very, very small enzyme, normally is the only enzyme that can be found in the urine. So if I ask you, which of the enzyme is normally found in the urine? The name of the enzyme is amylase. We have a tissue distribution like other enzymes. We have S type and P type. S is related to the salivary gland. So any disorder, any malignancy of the salivary can result in an alteration of the S type of this enzyme. And what is the P type? Pancreas. Okay? So we have two types. One of them is salivary origin, another one is P type or pancreas. And also not only in a salivary gland and pancreas we can find this enzyme, other liquid, for example like semen, testes, ovary, I don't know, lungs and other parts of the body contain a little amount of this enzyme. But salivary and pancreas considered as the most important origin of this enzyme. About another enzyme that originated from the pancreas is a what is the function of this enzyme?
To digest liquids, hydrolyze it.
What is the fat here? Which type of fat? Triglyceride. So as you understand from the name, this is an enzyme that digests the lipid. Okay? Which type of lipid? Triacylglycerol. It is utilized by this enzyme, and the concentration of this enzyme is 5,000 greater than other tissue. And also for the fully function is required colipase and bile salt. And as your friend mentioned, it actually hydrolyzes the fatty acids that bind to the alcohol, and the alcohol is glycerol, okay, triglycerol is the backbone of the alcohol glycerol, and 3 fatty acids bind by the ester bond. And you should know that actually only ester bonds at carbon number 1 and 3 are attacked by this enzyme. Okay? So, for example, if I have this structure about triglyceride, this is the glycerol, fatty acid number 1, fatty acid number 2, and fatty acid number 3. It means that this enzyme digests the fatty acid at the position of number 1 and number 3. So the number 2 position is remain. Okay? After digestion, we have 2 free acids, free fatty acids, and also monoglyceride. At this position,
2.
number 2. And like amylase, this enzyme is a recommended test for diagnosis some inflammation in the pancreas, and especially acute pancreatitis. About the trypsin, what is the function of trypsin?
Digestion of
Excellent.
proteins.
Digestion of protein. It's considered as in some references known as a serpine. Serpine, or serpine is abbreviation of the serine proteinase. What does it mean? It means that, do you remember the structure of the enzyme? They have an active site. Okay?
Yes.
And what was the active site? The substrate going to the active site. Whenever we say these are serpine or serine proteinases, it means that in their active site, this enzyme have a specific serine amino acid, okay? Because serine contains a hydroxyl group, if you remember. And this hydroxyl group is very important for the binding of a specific substrate. So, trypsin actually contains a specific serine. Not only serine, and also histidine and aspartic acid are present in the active site. But serine actually deserves a specific attention because it has a very specific role for the digestion of the enzyme. And as you understand, this is the digestion of the proteins. And I want to ask you, according to this figure, if you remember, we have several enzymes that's secreted from the pancreas, and all of them digest the protein, like chymotrypsin, like trypsin. Okay, we require different type. Why we require more than one type of enzyme that digests the protein?
Depending on the amino acid the protein is made of.
Excellent. Because we have an amino acid sequence inside the proteins, and each enzyme actually distinguish a specific amino acid sequence, and they cut from that specific site. Okay? So they actually follow the amino acid sequence, and they detect the amino acid sequence, and whenever they encounter with a specific site, they cut the protein. For example, about trypsin, which site is important? The amino acid or the peptide bond that formed by the carboxyl group of lysine and arginine. So if I ask you, what is the site of the breakage of the trypsin? Is the carboxyl part of the lysine and arginine. And if you remember, both of them are basic amino acid. And in the acute pancreatitis, because again this is a specific enzyme for the pancreas, the serum trypsin increase in parallel with the amylase. So trypsin and amylase, both of them are considered as biomarkers of the acute inflammation of the pancreas or pancreatitis. About the bone enzymes, as I mentioned, we have an alkaline phosphatase. Which cell contains alkaline phosphatase?
The bones. Osteoblast.
Osteoblast. What about the osteoclast? Acid phosphatase. So whenever you have any problem regarding to the destruction of the bone, you actually have a yeast inside. Maybe there is alteration about the acid phosphatase. So, as I mentioned, we have alkaline phosphatase and acid phosphatase. Both of them remove a phosphate. What is the difference between alkaline and acid?
One is in osteoclast.
And one is in the
No, what is about the difference about the environment of the enzyme activity?
Acid,
one is
basic.
in alkaline.
Alkaline.
pH,
The pH is
9,
different.
and the other one is
Basic.
pH is
acidic.
difference, okay? One of them require
Acidic
acidic
and one
environment, another one
neutral,
require the
alkaline.
alkaline or basic. So for the acid phosphatase, as the name implies, we require the low pH. And like alkaline phosphatase, they remove the phosphate, okay? Because the environment is important. Okay, what is the greatest concentration of this enzyme? Osteoclast.
Osteoclast.
And also you should know as a physician, prostate is important, okay? Whenever you have a patient, male patient, okay, older than 50, you should screen your patient about some problem or malignancies of the prostate, okay? You should order, one of the specific order is acid
Acid
phosphatase.
phosphatase.
And another one is PSA.
PSA.
Have you ever heard this name? Prostate specific antigen. Okay, so as a physician, you should order two markers: prostate specific antigen or PSA from laboratory and acid phosphatase. If your patient had abnormal PSA and acid phosphatase, you should order another, for example, examination, like a sonography test. Maybe there is some malignancy inside the prostate gland. Okay? So these markers are very important. PSA and acid phosphatase. And also we have a spleen, platelets, and erythrocyte. But osteoclast and prostate actually considered as the two main important organs. So this is a marker of the bone resorption. And also we have a moderate increase in a Paget disease. Do you remember the Paget disease? We have an uncontrolled activity of the osteoclast. It resorbs very rapidly. So actually acid phosphatase is higher. And also in a hyperparathyroidism with a skeletal involvement and some cancers, like for example prostate cancers and also some breast cancers can affect the concentration of these enzymes. About the other enzyme, this is the last enzyme I'm going to talk about it. This is a lactate dehydrogenase. Why I put this enzyme here? Because lactate dehydrogenase has a very wide distribution in a muscle, in a liver, in an RBC. Okay, this is a general. This is not very specific. So you should you should interpret the result of this enzyme beside the other results. Okay, you cannot just focus on the finding of this enzyme because, as I mentioned, it has a widely distributed in the organs. So this is not very specific. For example, amylase, I can take canose, amylase and lipase are just found in the pancreas. Okay? What about lactate dehydrogenase? Because it has a wide distribution, it is not related to the specific disorder. What is the function? As the name implies, it dehydrogenates the lactate and convert to the pyruvate. It is a reversible enzyme and will require the different pH for the forward and reverse reaction. In a normal, because what is the normal physiological pH?
7.4.
It's near to actually reverse reaction. So, normally in our body, the reduction of the pyruvate by means of NADH as a cofactor and form a lactate is favored. So, the reverse reaction is favored normally in physiological situation. What is the tissue distribution? We have actually two isoform. We have two subunits. One of them is H, is a heart, and also we have a M. Okay? H is for heart, as we expect. We have a high concentration, especially in a myocardium. Not only in the myocardium, in the RBC and in the kidney. And about the M4, because as you can see here, we have a different combination of subunits. We can find especially the skeletal muscles and the liver. So, for example, if you want to choose this isoenzyme, for example, for the skeletal muscles, and it's better to say liver, which type is important, which isoenzyme is important for the liver?
All these
Number
five.
5. What about the
LDH2?
anemia? I want to evaluate the anemia.
LDH1.
And
LDH2.
H2. Okay, so according to this tissue distribution, you can choose the best marker. These are the distribution, and this is the clinical importance. For example, number 1 is important for acute MI and hemolytic anemia and testicular tumors. And for example, lump number 5 is important for some disorder of the muscles and hepatocyte. And these are the clinical importance. So, as I mentioned, for anemia, actually, it's most important application of this enzyme. We should choose a number 1 and number 2 because of the tissue distribution. And lactate dehydrogenase number 2 compared to number 1 is most frequently found in RBC. So, lactate dehydrogenase 2 maybe is the best choice for the anemia. About the clinical significance, because of this wide distribution, as I mentioned, the increase of amount of this enzyme may be related to the several situations, like MI, inflammation of the liver, hepatitis, hemolysis is a disorder of the kidney, lung, and muscles. So, as I mentioned, this enzyme is not very specific biomarkers. But nowadays, measurements, activity of lactate dehydrogenase is very common in which field? Hematology and oncology, like some cancers. This is the last slide. This is the importance of the lactate dehydrogenase. If you remember, we have some hematopoietic vitamins, and vitamin B9, folic acid, and vitamin B12 and cobalamin were very important for the production of the mature RBCs. So any deficiency of these two vitamins can result in some alteration regarding to the production of the mature RBCs. So the erythrocytes, whenever pass through the bone marrow, they break down. So as a result, we have a hemolytic anemia and other kind of megaloblastic anemia. So whenever we have these two types of anemia, we have a high concentration of lactate dehydrogenase 1 and especially lactate dehydrogenase number 2. So this is a review of the some enzymes that are clinical importance. These are the tissue distribution, and these are the most important clinical application. Okay, do you have any question? Okay, so for today, we are going to actually measure the activity of alkaline phosphatase, okay? For today's experiment, we cannot distinguish between the origin of the alkaline phosphatase, okay? Maybe if you have a higher than normal, maybe this sample is for the pregnant women. Maybe this sample for the patient who have an accident. Maybe he or she is a normally growing children, or maybe it has some liver damage. Okay, we cannot distinguish. So we have a general. Today we have a general test for the alkaline phosphatase. But for physician in a hospital and in a laboratory, you can order, for example, lab, please, liver alkaline phosphatase. Lab, please, bone alkaline phosphatase. They have a specific method, okay? For example, they add a specific reagent to the test tube, and according to this procedure, the activity is just, for example, we have a mixture like this. For example, you have a serum of your patient, okay? And you want to measure the activity of the alkaline phosphatase. Maybe it's originated from the bone, from the placenta or the liver. In a laboratory, they add some reagents and they inactive, for example, liver and placenta. So according to procedure, only the bone-specific alkaline is active. And for example, normal and the value is related to the bone, okay? Maybe the physician order, I want to evaluate the activity of the placenta, okay? They choose another reagent, okay? This is, for example, liver, alkaline phosphatase bone. They add another reagent, and this reagent inactivates the liver and bone, and only placenta is remaining, okay? So the activity is exactly related to the alkaline phosphatase that originated from the placenta. Okay, but today we have an overall measurement of the alkaline phosphatase, and we cannot guess the origin is a bone, liver, placenta, or other tissues. Okay, when you want to start the practical, because we have a short pre-lab about the procedure of the test and some principle of the test. I think after 10 minutes, okay? After 10 minutes, I will start.